basically the process of coronary syndrome starts with the any amount of blockages, and tendency for blockages even starts even during the intrauterine life. So these days you can see that we are getting more and more cases of heart disease in younger population, and in fact the atherosclerosis, which was few years back considered to be the disease of old, you can find the link even during the intrauterine period. Well, we'll not go into detail in this lecture, but what we want to focus is what is acute coronary syndrome. So basically, when you have a certain degree of blockages like 30, 40, 50, 60, 70, or even 80, and you are getting the anginal symptoms. The definition of anginal symptom is when non-angina pain or looking typical MI pain or not. Then you look for the second thing you do. The first thing you do is ECG, whether the ECG is normal, whether there is ST depression or T wave inversion, or where there is a frank ST elevation. Patient with unstable angina and non-ST elevation MI can have a normal ECG, or they might have ST depression or T inversion. While the patient with ST.
Are you experiencing sudden chest pain? Don't ignore it, as every second counts. It could be acute coronary syndrome. This happens when blood flow to the heart is suddenly blocked. Common symptoms include chest pain, sweating, and anxiety. Pain may spread to the left arm, neck, or jaw. This is a medical emergency. Early treatment can save your life. Avoid smoking, manage stress, and stay active. If you notice symptoms, act fast. Save a life.
So what are the non-cardiac causes of raised trop T? Patient with a heart failure can have a raised trop T. Patient with myositis, patient with accelerated hypertension, especially when it is causing the heart failure, hypertensive heart failure, cardiac contusion or cardiac injury because of any reason. So post-MI patient will be having the raised trop T. If patient is undergone the PCI, they will again have a raised trop T. If patient is undergoing ablation therapy for atrial fibrillation or ventricular tachycardia or ventricular arrhythmias or supraventricular tachycardias, then again you can find the raised trop T. If patient has undergone cardioversion for ventricular tachycardia, ventricular fibrillation blocker, if you are suspecting the ischemic symptoms, because beta blocker decrease the heart rate, decrease the workloads, and they have the greatest mortality benefits. That's why they should always be used unless contraindicated. That means patient is if the patient is having asthma, allergy, or patient is in the heart failure. Those are the only three contraindications for the beta blockers. Nitrates, obviously, if there is a anginal pain. In cases of angina, you can repeat nitrates every 5 minutes sublingually. They should not be given in the standing position because they can cause the hypotension. They should be given in supine and sitting position. If you are suspecting inferior wall MI, then nitrate should be avoided, because if inferior wall MI is having RVMI, then the hypotension can be a cause. It can be precipitated by the nitrates. In cases of inferior MI with the RVMI, the treatment is IV fluid, and IV fluid. While in cases of anterior MI or anterolateral MI, generally, if the...
Are you experiencing sudden chest pain? Don't ignore it, as every second counts. It could be acute coronary syndrome. This happens when blood flow to the heart is suddenly blocked. Common symptoms include chest pain, sweating, and anxiety. Pain may spread to the left arm, neck, or jaw. This is a medical emergency. Early treatment can save your life. Avoid smoking, manage stress, and stay active. If you notice symptoms, act fast. Save a life.